All right, so we'll go ahead and get started. We have quite a few people here today. So I am Dr. Fahimeh Sasan. I'm the founding physician of Kindbody and a board certified OBGYN. Delighted to be spending the next hour with you with a focus of education and empowerment. And there's several members of our Kindbody team that are here with us today. They all have Kindbody after their name, and they're going to be available throughout this next hour to answer your questions. We do encourage everyone to put your questions into the chat as you think of them, and they will answer them for you right away. If there is anything that you don't feel comfortable sharing over chat, you can always reach us directly through navigator@kindbody.com. But I do encourage you to ask your questions, because from the times when we used to do these in person, any question you have is probably the same question that at least 10 or 20 other people have. And this is a safe place for us to congregate and learn more about our bodies and to really empower ourselves with choices and options. So I really do encourage you to ask questions, and we'll get started. Can't start this without saying Happy New Year to all of you. I know, I'm sure I speak for all of us that 2020 could not end fast enough, and I'm excited that we're starting this new year with a vaccine that's now hopefully going to change the face of this pandemic, and a new president coming, and lots of changes that are, I think, optimistic for ourselves and for our country. And so we're really excited that you're here. Um, Shafali's running my slides for me, so we can go ahead and get started. So what is Kindbody? At Kindbody, we are a national network of women's health and fertility practices, with a core mission and value of really changing the face of the delivery of reproductive health and fertility care to truly make it accessible for everyone, so that regardless of where you are in your reproductive journey, whether you're thinking about having a child, 10 years from now, you just want to learn more about your body, or you've already faced, miscarriages or fertility treatment failures, or you're really nowhere near wanting to think about children at all and just want to focus on your own wellness, we're here to be there for you. And we really serve our patients through venues like this, where we talk about just education and improving access to this type of information, as well as to our brick and mortar location. So I'm actually here in our flagship location here in New York City, and near Union Square, for those of you that are familiar with the area. And we have similar locations across the country, in San Francisco and Los Angeles. In Santa Monica, as well as in Princeton, New Jersey. We'll be opening in Seattle and Atlanta, Georgia, and Orlando and Austin over the next 6 months as well. And we also work directly with employers as a fertility and family building benefit, with a key idea that we want everyone to have maximum access to providers, to clinicians, to experts in the field, so that, again, regardless of where you are in your journey, we can be your partner and really help you through this journey. So next slide. So what do? We do the entire spectrum, a true comprehensive end-to-end solution for your reproductive needs. So we provide the entire spectrum of fertility care. Again, whether it's an assessment where you just want to learn more about your ovarian reserve, or you want to learn more about your sperm count, to virtual consultations, where right now with this pandemic and maybe you're not quite comfortable to come into a doctor's office, being able to do virtual consultations so you can learn more about yourself through that venue. We also do egg freezing, embryo freezing, intrauterine insemination, in vitro fertilization, donor egg, donor sperm, surrogacy. So the entire array of fertility services. We also provide the full spectrum of gynecologic care. So again, if you have no interest in fertility, that's okay. At this point, well, you can come to us for your pap smears, for your contraception, for your IUDs, and for anything that entails any of your gynecologic needs. In addition, we do counseling and support because you really can't just take care of a woman's uterus and ovaries and call it a day. So we provide mental health services, nutrition support, as mental health and nutrition are so paramountly important in the well-being and fertility of a person, whether they're interested in having a baby now or in the future. We also provide LGBTQ services as it relates to our fertility and GYN services, but also as you think about donor agencies or specific therapists to deal with what does it mean that I'm using donor egg or donor embryo, and all of that is all encompassed under the same roof with excellent attention to the patient experience, because that's so paramount to us as a company and is so important to me as a founding physician, as a woman, and as a mom. All right. So, an update on the services. I know, like I said, started off with 2020 was a year like none other. And obviously, we're still in the thick of the pandemic, as our cities are closed and we're on lockdown, and we're really still facing so many traumas as it relates to the COVID pandemic. But we do really want to remind, and I personally want to remind each and every one of you how essential your health care is. So, if all through 2020 you were like, I'm not going to go have my well woman checkup, or I'm not going to go check on my fertility, or I'm not going to go to the doctor's office because of the COVID pandemic, well, it's not quite going anywhere just yet. So I really do want to remind all of you how important it is to still seek out, whether it's just for your wellness checkups or your pap smear, as well as looking into your fertility. Because as you'll learn over the course of the next few slides, our fertility doesn't wait for pandemics to be over, and our healthcare is so important now more than ever. But as a result, throughout this pandemic, we're taking extreme precautions in all of our clinics, with your safety as our top priority. So everyone that comes into our clinics, including our staff members and our patients, is getting their temperature checked. We're doing extreme sanitization of all services, and really trying our best to keep our waiting rooms as empty as possible, so that you're really coming in and going directly into a doctor's office. So I'm standing in our clinic now without a mask, only because I know there's no one around me. But generally speaking, we're all masked and staying protective for both your sake and ours. All right, so let's get down to the business at hand. Fertility 101. Why does this matter? And the reason why I really want to focus this conversation on just some basic facts is that we really spend most of our adult lives, or all of our adult lives, really focusing on how to not get pregnant. Right. When you think back on sex education, whether you had it in middle school or at some point in your life, the focus was, how do I not get pregnant, and how do I not get an STD, right? And so then when the time comes, and fast forward, and we're evolved in our adult lives, and we're ready to have a baby, or we're ready to start this conception process, many of us have no idea where to begin. And it's to no fault of our own. You could be the most educated person and have the most highest caliber of work status, and this is something that we fundamentally lack a tremendous amount of knowledge on, and I want to make that right for you, hopefully over the next few minutes. All right. So, what should we know? When it comes to fertility, the most important thing for all of us to know is that age really does matter. And I think we all understand that there's some benchmark about age, but I think there's a misconception that just because you're a really healthy person, or just because you take really good care of yourself, that somehow you can beat your age. I often sometimes will sit down with women in my office who are, in their 40s, and they say, oh, well, I know normally fertility declines for most women when they're in their 40s, but I take really good care of myself, and I'm a really young 40, so my fertility is going to be good. And the reality of the matter is our eggs don't know how, well we take care of ourselves, or how beautiful we look on the outside. And so it's truly important for us to understand how important our age is. Okay. So next slide. All right, so let's get started at the beginning. The core focus of female fertility is that as women, we're born with all the eggs we'll ever have. And our egg count and our egg quality declines with age. So at birth, we have about 2 million eggs. By the time we reach our very first period, so think in your mind, you were likely somewhere between 9 to 12, 13 years old. Some people may be a little bit older. But by the time we reach our very first period, we're already down to 300 to 400,000 eggs. I hope your jaws are dropping because that's truly unfair, right? We're born with 2 million and we're already down to 300 to 400,000 within basically the first decade of our lives. From there, every month, and this is regardless of whether you get a period or not, whether you're on birth control or not, whether you have an IUD or not, we lose up to 1,000 eggs a month. So if we're born with a maximum amount of eggs and we're losing eggs pretty dramatically throughout our life, then it becomes really important to understand that our age really does matter. And this isn't something where a lifestyle modification can make it better. So a lot of medicine is focused on, okay, you have diabetes, you change your diet, you eat better, your diabetes will improve. This isn't something that we can effectuate change on. So it becomes really important to empower ourselves with the knowledge so we can then make the decisions that are right for us, that make sense for our family building goals. All right. So let's talk about age, right? A lot of people, like I said, started off with, have some understanding of there's an age, and a lot of people may know, or maybe you don't know, that somehow 35 is important. The reason for that is, okay. So going back, if you're born with about 2 million eggs at birth, we go down to 300 to 400,000 by the time of our first period, and we're losing about 1,000 eggs a month. Then typically, by the time we reach 35, many women who are 35 and older will have low egg counts. Okay. But unfortunately, not everyone follows the same rules. So one out of 10 women will have premature decline in their egg count prior to the age of 35. And there's no way that she would know that she was one of those 1 out of 10 unless she got her fertility checked. And there's unfortunately no like warning signs. It's not like your period looks different or your cycle changes or you have a symptom or you have a pain or you have some marker where that could trigger you, oh, my egg count must be low. It's something that happens silently. And so it's the key thing to understand with fertility is our fertility is gradually declining from birth. It's not like we're perfect, 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 and suddenly at 35 we fall off a cliff. And then to also understand that everyone's rate of decline can be different. And so then it becomes fundamentally important to not just assume that your fertility is good because you're young, and also conversely not to assume your fertility is poor because you're older, and to really allow us to tell you your true facts by doing the things I'm going to tell you through a fertility assessment over the next few minutes so that you can truly understand what is my objective truth so that you can then make the decisions that are right for you. All right. So two things matter: our egg quality and our quantity decline with age. And by quality, I'm purely referring to the DNA, those 23 chromosomes that make up an egg cell. And what happens is because we're born with all the eggs we'll ever have, our eggs at any given moment in time are always going to be as old as we are. And as we age, a product of aging is that our cells age. And with the aging of cells becomes a decline in our chromosomal DNA quality of our eggs. The same way as you age, you may develop wrinkles, your hair turns white, or skin changes. That same product of aging happens to our eggs as well. And so that's why it's so important to keep that in mind as we think about our ideal future families. All right. So the reality is that you're never too young or too old to learn more about your fertility, to learn more about your own objective truths, and then to know where you stand. And then that provides us an opportunity to be proactive. And what I mean by that, to go back to our diabetes analogy, is that the way that our healthcare system currently looks at fertility is that we wait for women to have a problem before we address it, right? So typically what's told to women is, oh, someone comes says asks their OBGYN, well, I'd like to know more about my fertility, the standard response is usually, oh, well, you're young. Don't worry, when you're ready, you'll try for a year. And if you're not able to get pregnant after a year of trying, then let me know and I'll refer you to a specialist. So going back to the diabetes analogy, that would be like waiting for a diabetic person to have a heart attack before you told them they should eat better and that they should watch their sugars or that they should lose weight or exercise. And so when I say I want each and every one of us to be proactive about our fertility, is that I want us to learn, regardless of what age we are, again, never too young or too old, to at least learn about our ovarian reserve and our egg counts so that we can then make the decisions for our future that are right for us, as opposed to waiting for a year and then finding out, oh my gosh, my egg count is low. I wish I had done something a year ago. So proactive is key in this topic, just as it is key in any other facet of our healthcare. All right. So when are we most fertile? What am I talking about, right? So in this graphic, key things to understand. Remember I said we spend our whole lives thinking the moment we have sex we're going to get pregnant, but the truth is that we're only fertile for about 5 days in a given month. 72 hours. That's it. So in this May 2020 graphic, the first day of the month, which is that Friday represented with that red dot, was the first day of this woman's period. And so her fertile window would be the 10th through the 14th. That's it. So the rest of the month, even if she was to have unprotected sex on a daily basis, the likelihood that she would conceive would be really little. And so if we go back and understand that our fertile window is only 5 days in a month, and then we start thinking about, oh, and as I age, my fertility is going to decline, all of this kind of comes together, and understanding that having a baby and fertility isn't as simple as we grow up thinking, and there's a lot more to it than meets the eye, and we want to be here to help simplify it, help you understand what to do, how to do it, and so that you can kind of achieve all of your goals when you're ready to do that. All right. So, what factors impact fertility, right? I mentioned to you age, but there's other things for us to keep in mind. Certainly, our diet and our lifestyle are important. Not that they directly impact our fertility, but it's always good to be the best version of ourselves, right? Having a healthy immune system helps you be a healthier in anticipation of a pregnancy or even once you're pregnant. And our lifestyle choices matter. A few things that are key is that smoking, both cigarettes and marijuana, has been shown to adversely affect male and female fertility. So, if you needed another reason not to smoke cigarettes, here's one. Smoking cigarettes actually harms female and male fertility. It can reduce egg counts and reduce sperm counts. So, definitely stop smoking. The second thing that's really important is our family history, but maybe not exactly in the way that you thought. Key things to keep in mind as far as family history is, how old was your mom or the women in your family or your grandmother when they stopped getting their periods? And I'm talking about when they stopped getting their periods through natural menopause, not if they had surgery for some reason. If you have women in your family who went through menopause, meaning they stopped getting their periods completely under the age of 45, then you could be at risk for also having early menopause. And that's an important thing to know. So if you're not sure what that answer is to that question, next time you're chatting with the women in your family, if you have access to them, ask them that question. And if they do say, oh yeah, I was less than 45, that would be something to bring to your doctor's attention. Other things that are so important, and I think now more than ever, is our mental health. We know that stress impacts fertility. We know stress and cortisol levels can impact our ovulation. So all of that becomes so vitally important as we venture into being the healthiest version of ourselves, as well as thinking about our fertility. All right. So at the end of the day, key things are that there's no magic formula, that everyone is different, and truly that we're never too young or too old to learn more about where we personally stand. Because once you have that objective information, you can make the decisions that are right for you. All right. So let's get down to the nitty gritty. Like, how do I learn more about my body? We can do a fertility assessment. And what a fertility assessment entails is three, fairly simple things. The first part is having a consultation to really review your full story. What are your medical history? What is your surgical history? What are your allergies? What medications do you take? What is your family history as far as cancers or genetic disorders? How old was your mom and grandmother when they stopped having their period? And that consultation can occur either virtually or in person, depending on what you're comfortable with. And you can book those appointments directly through our website at kindbody.com. We have appointments available 6 days a week, Monday through Saturday, as early as 8 a.m., as late as 6 p.m. on both coasts. And so that is available for you anytime. The second part of the assessment is to do a vaginal ultrasound. So if you started off step one virtually, then obviously this portion would happen. And you would come in, make an appointment to come in. If you did the initial part of your assessment in the clinic, then this portion would happen on the same day. And this vaginal ultrasound allows us to, one, look at the structure of your uterus and ovaries and ensure, do you have fibroids? Do you have any ovarian cysts? If you do have fibroids or cysts, how big are they? How are they going to impact your fertility or your health in general? The next step in the vaginal ultrasound is to count the follicles within your ovaries. A follicle count allows us to see how many premature eggs do you have in your ovaries. And this is a number that you'll get to learn about that same day. It's a live measurement that allows us to tell you about that. The next step in a fertility assessment is blood work. And we can do that on the same day again if you came in person. And that blood test specifically checks a hormone called anti-Müllerian hormone, which gives us an estimation of how many eggs do you have left from that 2 million you were born with. And AMH is reported as a score, so that a score of 1 to 6 would indicate a good egg count, and a score less than 1 would indicate a low egg count. And once you come into our office and we've done steps 1 through 3, you then will be able to see your results through your Kindbody patient portal, where you can easily see your AMH levels and your follicle counts with nice descriptions so that you can truly understand what your results mean, as well as you'll have your provider that you met with who will be able to go over all of that with you and help you understand, well, where do I stand today? What are my objective truths? And this becomes so empowering. And I know some women are really sometimes nervous to come and do the assessment. But what I find is that once you come through and kind of rip off the band-aid and you come and you do it, even if you find out your results are great and your fertility is awesome, or you find out your fertility is low, it can truly be an empowering and give you a step of like, okay, well, now I know, and now I can make the appropriate choices for me based on what I want. Next slide. All right. So then once you have your results, we can help you explore your options. So we'll talk to you about egg freezing, embryo freezing, or if you're trying to conceive, intrauterine insemination and vitro fertilization, and really help you understand what makes sense for you based on the number of children you want and when you decide to have them. So what is egg freezing, right? Let's talk about that for a few moments. So remember I mentioned to you that we're born with all the eggs we'll ever have, and we lose eggs as we age. So think about egg freezing as an opportunity to say, okay, I lose up to 1,000 eggs a month, whether I like it or not. And so I would like to save some of these eggs, almost like pressing pause on your fertility, so I can use them in the future if I need them. That's what egg freezing is. It's just truly an opportunity to say, I am going to preserve the quality and quantity of my eggs today as I stand, however old I am today, so that I can use these eggs in the future if I happen to need them. All right. So who should consider egg freezing, right? So I have 4 questions that I would like all of you to answer for yourselves. If you have a partner, answer these questions by yourself before you share your answers with your partner to see where you land. The first one's super easy. How old are you? The second one is, how many kids are in your ideal family? And be honest. And maybe that answer is 0. And maybe that answer is 3 or 4 or more, or just 1 or 2. But be truly honest. In your ideal family, everything else aside, how many kids would there be? The next question, and these get a little bit harder as they go, is how old will I be realistically? How old will you be realistically when you have your first child? And as you answer this question, take into consideration your finances, your relationship status, your job aspirations, maybe your travel aspirations post COVID, all the things that play a really important role in when deciding when you want to have kids. The last question, which is I think the most important of all of these, is that if you said you wanted more than one child, then realistically, how old will you be when you have your last child? And I think how old are you going to be when you have your first child, and how old you're going to be when you have your last child are questions that we don't often think about, because we just think about, like, where am I in my life? Am I ever going to have kids? And it becomes important to know these things, because if you're going to have one or all of your children over the age of 35, then egg freezing is something that you should at least consider as an opportunity to preserve your fertility and allow you to really um, in, make happen your ideal family dream goals. Okay. All right. So, how does egg freezing work? All right. So, I have a tissue box analogy that I'm going to go over with you guys that I think is helpful in understanding this. So, imagine this tissue box represents your ovaries. At any given moment in time, within this tissue box are all the eggs you'll ever have. There's no way to put more eggs in, there's no way to add more tissues. So, today, January 13th, 2021, within your body and your ovaries are all the eggs you'll ever have. When we do an ultrasound, we can't see how many eggs are in your ovaries, just like you can't tell how many tissues are in this box. So the AMH level, that hormone I was telling you about, would be like a gauge. If you could somehow gauge how many tissues are left in this box, the AMH would tell us how many eggs do you have left in total from when you were born. So 6 would be full, 5, 4, 3, 2, 1, all the way down to 0. Each month, your body takes a group of your eggs and recruits them to grow and mature. This group of eggs, because they've grown, we can actually count on sonogram. So when you come in and we do that vaginal ultrasound and we tell you how many follicles you have, we're literally counting the group of eggs that were recruited that month. And then what naturally occurs is our body, our brain, sends a signal to this group of eggs to help one egg fully mature. This one fully mature egg is the only egg in your body that has the capability of becoming a baby. This is ovulation, right? So what then occurs is, let's say you're not having sex or you're using protection or whatever the case may be. At the end of the month, this one mature egg is lost, and the remaining, this group that was recruited, is also lost. And next month, your body will go back to your ovaries and recruit another batch of eggs. And this cycle will continue until you run out of eggs. So what we do with egg freezing is we say, okay, so we have this group of eggs that your body's going to lose over the next month. And we know that only a mature egg has the capability of becoming a baby. So we give you hormones in the form of injections with the idea of helping this whole group of eggs mature together, so that once they're mature, because maturity is key, we can extract them and save them for you to use in the future. That's all we're doing, is helping a group of your eggs that you would otherwise lose mature, so we can save them for the future. We're not making new eggs. We're not capable of recruiting extra eggs. We're not somehow altering the quality of these eggs. All we're able to do is help them mature. So that's what egg freezing is. And to answer some questions that often come up, as a result, egg freezing is not stealing from your fertility. It's not going to put you into early menopause. It doesn't make it harder for you to get pregnant naturally. We're just taking that group of eggs that would otherwise have been lost that month anyway. Okay? Next slide. All right. And so during that process, again, a lot of times people will ask, why do I have to take hormones? Is there a way that I can do egg freezing without hormone injections? The reason we need those hormones is the hormones are what help our eggs mature, right? And it's the same hormones that your brain releases. So it's something your body has already been exposed to your whole life. And that's why the response is actually quite good. And we'll go over what to expect in just a moment. Okay, next slide. Right. So the hormones are administered typically over a 10-day period. Okay. And again, as I mentioned to you, that's helping your batch of eggs mature. And we monitor the progress, right? Remember, I said you have this batch of eggs and we're helping them mature. We monitor the progress of the maturity of your eggs with blood work and ultrasound. The key thing to understand is that egg freezing is not a cookie cutter recipe where everyone starts the same, everyone ends the same, and everyone has the exact same experience. The egg freezing process is really unique to each individual, and how a person responds will be uniquely different for each individual. Next slide. All right, so here's a sample graphic of how that would look. It might be a little bit small, but follow me and I'll kind of point to the big things. So a total egg freezing process from beginning to end takes a maximum of 14 days. Okay, so, and it typically will start with your period. So in this calendar, see the yellow circle under the Wednesday in the middle of the screen? That would represent the first day of a woman's period. So there's two ways that we can start an egg freezing cycle. We can either start an egg freezing cycle with the start of your period, or if you're on birth control pills, we can time the start by telling you when to stop your pill. But let's just, for the sake of this conversation, say we're going to start with your period. So the yellow dot under that middle Wednesday represents the first day of your period. You would start your cycle 2 days later on that Friday, and you would be done by 2 weeks maximum. And so what we're doing is having you come in every other day. During that process, we're watching your eggs mature. And once your eggs reach full maturity, which is paramountly important and the key of this process, we would then extract them. And that is the retrieval day, which I'll explain in a moment. Key thing to understand is if you and 10 friends all started the egg freezing process on the same day because you all happened to get your period on the same day, you would finish on different days because we would retrieve your eggs based on your individual eggs maturity, not based on a cookie cutter recipe. But the time commitment is not as much as people think, just 14 days maximum from beginning to end. Next slide. All right, so how does the egg retrieval work? So the retrieval is done when your eggs reach full maturity, and it's a 10 to 15-minute procedure done under an IV anesthetic. So you are asleep, so don't worry, you won't feel anything. But it's not like general anesthesia with a tube down your throat. It is an IV sedation. 10 to 15 minutes. It's done through with a very small needle through the vagina. There's no cuts, there's no incisions, no stitches, really considered a minor procedure, and all done within our facilities, whether you're in the East Coast, West Coast, New Jersey, all done in our own private Kindbody facilities with anesthesiologists, embryologists, and fertility specialists. All right. So one of the questions that a lot of people ask, well, is it better for me to freeze eggs or embryos? And the key thing to understand before we, begin on understanding that is that there's been some amazing advances in egg freezing over the last 10 to 15 years. And so sometimes people will come and say, well, I've done a lot of Google research and everywhere I look, it says that you should do embryo freezing. And that's all old data. So the changes that happened with egg freezing are a process by which we learned and perfected the egg freezing process so that it allows us to freeze and thaw eggs to perfection. And with the advent and advances in those science, egg freezing and embryo freezing has now become equal. The key difference is always going to be with the success rates is going to be how old was the woman when she froze her eggs and how many eggs does she have frozen. In the same woman, let's say you're 35 years old, a 35-year-old woman's eggs are going to respond exactly the same way, whether I fertilize them today or I fertilize them in 10 years. So that's the difference. So an egg is just an egg. An embryo is an egg that has been fertilized with sperm. So the key difference becomes is that when you make embryos, we have more information, right? Because we've already taken that egg, we've fertilized it with sperm, we've allowed that reaction to occur, and an embryo is now present that we can biopsy and genetically know, is this a boy, is it a girl, is there Down syndrome, is it genetically normal? We're not able scientifically to genetically test eggs or sperm, but we can genetically test embryos. So key difference is not that the success rates are different, but that if you make embryos, you have more information. And obviously an important part to think about as you think about making embryos, if that's something that interests you, is just understanding that you've then committed to the sperm, right? Once we fertilize an egg and create an embryo, we can't unfertilize it. And so that becomes important as you think about, well, who do I want to have children with? And if you're picking donor sperm, is this the donor that I want to commit all my eggs to? Or if you have a partner, is this a partner that I want to have children with? And remember, it's all about options and maximizing those options. Next slide. All right, so what comes next? Well, those eggs or embryos are then stored in our facilities. Everything is Kindbody as long as you want. And that's the cool kind of mind-blowing part of egg and embryo freezing, is that you're then truly pressing pause. So those eggs will be as good as the day they were frozen for even 100 years. Now, obviously you won't be around in 100 years, but the key thing to understand is that there's no shelf life for those eggs or embryos. They will stay as good as the day they were frozen indefinitely. And if you decide, let's say you did do egg freezing and you're now ready to have a child and you're ready to have your first kid or your third kid, and your fertility has declined, we could then take those eggs, fertilize them with sperm, create an embryo, and then transfer that embryo in your uterus to grow, which is what IVF is. Next slide. So the key thing is that IVF, which is in vitro fertilization, is just the second half of egg freezing. Okay. So whether a person is going through egg freezing or IVF, that 14-day scenario, this tissue box analogy that I showed you guys, is exactly the same. The monitoring is the same. The injections are the same. The retrieval is the same. The only difference between someone doing egg freezing and doing IVF is when she wants to be pregnant. So if you want to be pregnant now, then as soon as we take the eggs out, we'll fertilize them with sperm. If you want to be pregnant 10 years from now, we're just going to freeze those eggs and leave them be until you're ready. And that's the key difference. There's no other aspect of it that is any different. It's still just 14 days. All of that part is the same. Okay. And then one of the most important things to understand with improvements and advances in vitro fertilization is that with the advent of being able to genetically test an embryo, we've done two remarkable things. One, we know that a genetically normal embryo has a significantly better and the best chances of becoming a baby, 10 months later. So it improves success rates. And two, it allows us to transfer one genetically normal embryo into the uterus to reduce the risk of multiples and twins and triplets, which we know are associated with birth difficulties and preterm labor, preterm delivery, miscarriage, NICU or neonatal ICU admissions. So those two advances in IVF have revolutionized fertility. Genetically testing an embryo to ensure that you transfer a genetically normal embryo improves success rates. And by being able to transfer only one embryo, we can reduce the risk of twins and multiples. All right. So let's go back to some definitions. So what does it mean to be infertile? Just to give you some definitions. If you are over the age of 35, if you have been trying to conceive naturally and have not gotten pregnant in 6 months, that is considered by definition infertile. If you are under the age of 35, if you've been trying to conceive and have not been successful for 1 year, you would be considered infertile. 1 out of 8 couples will experience infertility. And these are couples of all shapes and sizes, right? You could be a heterosexual couple, you could be a same sex couple, you could be a woman who's choosing to have a child on your own. But 1 out of 8 people will experience infertility. And a third of infertility issues are actually due to the sperm, which is called male factor. And so I implore you, if you do have a partner, and that partner is male, and whether you want to have kids with that person now or in the future, I think it's so vitally important to include them in this conversation and have them do a semen analysis to make sure that they're okay as well so that we can address it. And the key thing, yes, I gave you the definitions of infertility in 6 months and a year, but I think it's so important that we kind of put away these archaic definitions and we focus on being proactive. There's no reason why you should try for a year before you go and checked out and make sure that your fertility is good. And that I encourage couples, again, regardless of where you are and what type of couple you are, is to go and get an assessment. Learn about the eggs, learn about the sperm, learn about your uterus, learn about your body, your genetic carrier status, all of these things before you start trying to conceive, so that if there is a problem, we can address it. And we know that fertility is impacted by time. And since time is not on our side, we can take advantage of all of these tools that are at our disposal to make the right choices. All right. So past to parenthood, right? Just having sex is like so yesterday, right? So there's so many paths to parenthood, and that could be through intrauterine insemination using donor sperm, or frozen sperm, and really helping you explore, what is the best, what do I need to look at when I'm picking a donor sperm, and what are the good reputable agencies that I should be using, and what is the testing that I should be looking at, like including genetic screening of myself and my female partner, so that we both pick the right sperm that's going to be compatible for both of us. In vitro fertilization, which is where, and are we taking your own eggs or donor egg, or are we using your partner eggs, which is then and create and sorry, and fertilizing it with sperm and putting it in your other partner, which would be reciprocal IVF, which can be done in same-sex female couples, or is it just helping you with your ovulation induction and just helping you understand when's the best time for me to have sex if I want to conceive? So really helping you explore your treatment options and better understand what is the best path to achieve a successful pregnancy. And then helping you understand egg donors and gestational carriers, and helping, a same-sex male couple understand, how do we go about this process, because it can be from far away much more complicated and involved than people may realize, and we're here to help simplify it and kind of be your partner every step of the way. The take home message is you have options. And one of the key things that I really want to embark is that a lot of people think that if they're having a fertility issue, that the only treatment is IVF. And we really want to focus on you as an individual and helping you understand your options and going over with you what is the thing that's going to be the most successful, and then being your partner and helping you decide where you want to start, how aggressive you want to be. But it's never going to be a situation where it's one size fits all and everyone who's having fertility issues must have IVF. We really want to be your partner. All right. All right. So, what's the next step? Well, whether you are actively trying to not get pregnant or you are actively trying to conceive, whether you are in a same sex relationship or in a heterosexual relationship, whether you're married, you're single, you want to have a kid on your own, whether you just want to learn more about your body because your birthday is coming up and you're not quite sure what's going on, regardless of where you are in your journey, the first step is to just learn more about your body. Do that fertility assessment. And then that way you can really help shape your decisions, shape your next steps based on those truths. All right. So let's talk about cost. It's like the elephant in the room when we talk about fertility. And at Kindbody, one of our missions is to truly help and make it more accessible. So your fertility assessment, you guys are going to use this code from this talk. It's January 101, and that will give you a discount. If you don't have insurance, then that will make the price of the assessment $150. If you do have insurance, then all you would be responsible for is your copay, and we do accept all the major insurances for your convenience. An egg freezing cycle is typically 6,500. So with this code, you would get $500 off, which would make that 6,000. Just to give you some clarity, the egg freezing cycle, the $6,000 would include all the visits, all the ultrasounds, the retrieval, the anesthesia, and the first year of storage. In addition would be the cost of the medications. And we can help you better understand exactly how much your medicines would cost once we do your assessment, because they are going to vary from woman to woman. IVF cycle would be $12,000, and then IUI would be $1,000. You can schedule your appointments directly at kindbody.com and then enter that promo code January 101. And you can make appointments literally right now, 6 days a week, in New York, in San Francisco, in Santa Monica, in LA, at Century City, which is one of our newest locations, and also virtual appointments if you happen to be somewhere we are not. I know there's a couple of people from Chicago and DC, and then we can help you explore your next step. Next slide. We do accept all the insurances, so all the major names are all here for you. We also do accept FSA and HSA, and you may also have a benefit through your employer that you can utilize. And so with egg freezing in particular, most insurances, like your major medical insurance, is not going to cover egg freezing, but many employers do have benefits where while it may not be covered through your major medical, your employer has a benefit that could cover egg freezing or some of your fertility benefits. And we can help you explore all of that. So all you need to do is just reach out to us at navigator@kindbody.com or come and see us, and we'll help you totally understand down to the penny what your costs will be and what your deductible is and all of that. Because again, we want to be your partner in this and help simplify it as much as possible. If you happen to work somewhere and you want to help us champion your cause, we have a whole designated team of people that can actually go to your employer and help champion the cause of getting better fertility benefits for you and your colleagues. And the key thing to understand with this is that it's all about improving access and understanding that across the country, women are waiting longer to have children. And as we wait longer to have children, our fertility issues are going to increase, and all of this goes hand in hand. And so, so definitely let us know if we can be of assistance in helping you start this conversation with your employer. And I think that's the end of our talk. So I know that my amazing team has been feverishly answering your questions through chat, but Rebecca Silver, who's our Director of Marketing and Brand, are there any common themes that maybe I could address with everyone? I'd be happy to do that.
So many great questions. Thank you everyone for submitting them. If you have any burning questions that were not answered, you can submit them again now. I'll start at the beginning of the talk. Some of the ones we got in the beginning were about the fertility assessment. One question we saw is, how often should you come in for an assessment? When should you start thinking about coming in? If you got one a year ago, should you come in again?
Yeah, absolutely. So how often a woman should do it is really going to depend on your age. What I would say is if you're in your 20s and early 30s, once a year is going to be enough. And I would make it just like a part of your regular checkups, just like you should be going to the gynecologist to have a breast exam and a pelvic exam and maybe refill your birth control once a year. Then that could become just part of your checkup. If you're older, over 35, or if you've previously been told that your fertility is low, then I would want to shorten those assessment windows to sometimes 3 to 6 months apart. And if you're not sure, you can always bring us any assessments you've done previously, and we would be happy to help you understand whether it's time for another one and how helpful that information can be.
Thank you. We saw a few questions about birth control. Should people stop taking birth control prior to coming into an assessment or make any other changes with birth control?
It's a great question. The great part about this AMH level and the follicle count is that you come as you are. You do not need to schedule your appointment during a special time in your cycle. You can be on your period, off your period. You can be on birth control or not. You can have an IUD in place. It's not going to impact your results. So come as you are. You don't have to make any lifestyle changes. You don't have to stop your birth control. We can do this testing efficiently and accurately with your birth control in place or continued. In very small instances, we may tell you after we see you to stop your birth control and repeat your testing, but those are isolated situations in some women. But the general rule is come as you are.
Thank you. This is a good one we just got. Someone asked if you want 3 kids, do you need 3 separate egg retrievals or 30 eggs at once? How do you think about eggs in relation to the number of kids that you want?
Oh, perfect. So the way we think about eggs, if you're in your 20s and early 30s, the whole concept is we need 10 frozen eggs for every 1 child you want to have. And the reason for it is that in any 10 eggs, some of the eggs will not fertilize, some of the eggs will fertilize and not grow, and some will be genetically abnormal, which would leave us with 1. So when we counsel women, we want 10 eggs for every 1 child that you wish to have, and understanding that obviously there's never a guarantee, but that 10 eggs would give you an improved chance of 1 baby. So we help you understand, depending on your fertility and depending on your egg counts, we can help you decide how many cycles you personally need to do. And then how many cycles you end up doing will depend on your fertility. If your fertility is great and you end up getting 20 eggs and you want to have 2 kids, then we might be 1 and done. If your fertility is poor or low, you may need to do multiple rounds, even just to get 10 eggs. So we're going to help you explore all of that. That's a vital part of the discussion after you do your assessment.
Thank you. We just got a few questions about timeline. If you're thinking about or recommended to do 2 cycles of egg freezing, how do you recommend spacing out 2 cycles?
It's really going to depend on the individual. Again, I can't stress enough how individualized this entire process is. Remember, it always starts with your period. So sometimes we can do periods back to back if your hormone levels and your ovaries go back to their baseline. And sometimes we'll advise you to take a month off in between. So typically the 2 ways it'll happen is either you do it back to back, period in January, period in February. And sometimes we'll do January, take February off, and do the next one in March. And we'll help you understand which one is going to be good for you. But it's really going to depend on how you respond to the egg freezing process and what your hormone levels are and your ovaries look like at the end of your cycle. Safety is always paramount.
Thank you. Now, you recommend 10 eggs for 1 baby. To think about it like that, how do you recommend thinking about the number of embryos you should aim for 1 baby?
So embryos, again, remember I've told you the main difference is with an embryo, we actually have the egg, the sperm, we've created an embryo, we can even do genetic testing. And so in that case, if we have a genetically tested embryo that's normal, that's going to have a very significant chance of becoming a live birth. So in that case, we don't need a 10-to-1 ratio. We can truly, we always want to have a little bit of wiggle room. So we never one embryo for every kid you have, but it comes much less. So I think most people say, having 2 or max 3 embryos for every child would be good, good backup or a good sense of peace of mind.
Okay, thank you. We got a number of questions about the COVID vaccine. Is this something that you should be concerned about if you are undergoing fertility treatment or trying to get pregnant or are pregnant?
Absolutely. So, as I'm sure everyone can attest to, there's so much about this vaccine and coronavirus in general that we don't know about. And if you watch the news every single day and every minute, there's updates and advances that are being made. But currently, the recommendation is that if you're going to be going through egg freezing or embryo freezing, that you would get vaccinated anytime, and there's no considerations to be made. And really in the medical community, the advice is transitioning towards that people who are pregnant should get vaccinated, because we know that pregnancy itself can cause a diminished state, diminish our hormonal, our immune system, sorry, can diminish our immune system. But right now, there's some controversy as to whether or not people should get vaccinated during their first trimester. So if someone is going to start fertility treatments, we would have them get vaccinated before they got pregnant. And then if you're already pregnant, likely waiting to your second trimester. And again, we're constantly keeping our finger on the pulse of any vaccine updates. So as we get them, we'll provide them to you.
Thank you. Just a few more questions before we wrap. How long are frozen eggs or embryos good for? How long can they stay frozen for?
Yeah, theoretically 100 years. There's no, once they're frozen, they really can be kept frozen and would be as good as the day they were frozen. Right before the holidays, there was actually a baby that was born from an embryo that had been frozen for 27 years, and that broke the record. So the baby, it's this cute baby. You guys should Google it. But this baby was born from an embryo that had been frozen for, almost 3 decades, and so, but our scientific studies show that there's no shelf life. So for most women, it's going to be far longer than your reproductive window would be anyway.
Thank you. Can you confirm or answer the question on whether freezing your eggs or embryos would have any adverse effect on your fertility later on, if it would take out eggs you might be able to use later?
Not at all. So remember, back to my tissue box analogy, your body's recruiting a group of eggs each month that are going to be lost. We're just freezing this group that's going to be lost anyway. We're not touching your stockpile. And so we're not putting you into early menopause. And actually, someone could freeze their eggs in January and get pregnant naturally in February. And sometimes people do that, especially couples or women who want to have more than one child will go through an egg freezing cycle and just to preserve their fertility before they get pregnant. Because once you're pregnant, pregnancy is 10 months. And if you decide to breastfeed, that might be 6 months to a year. So we lost you for 2 years, 1 year of being pregnant and 1 year in that post-pregnancy period. So you can freeze your eggs and then turn around right away and get pregnant and would not harm your fertility anyway. And also, just on the same topic, there's no correlation or association with egg freezing and IVF or IVF and cancers later. There's no increased risk of breast cancer or any other cancers, and it does not impact your health in any way either. And that's been well proven over the decades that we've been doing this type of treatment.
Thank you. So that's been an hour. We do encourage anyone who has more questions to email our team at navigator@kindbody.com. I also just want to answer a few questions about pricing. The discount that we gave you, you can book your appointment this month, but you can schedule it for February or at a later date. That's totally fine. We're going to send you an email tomorrow with that discount information, just so you have everything in one place. And then I saw a question about, do we have any success stories we can share? We have lots of amazing ones. You can find them on our Instagram, on our website. And then Dr. Sasan, if you want to share anything about our patients and success stories that we've had.
Absolutely. We do have tons of success rates. And our success rates are going to be with our IVF patients and our fertility patients, because most people don't freeze their eggs with the intent of using them 6 months later. So usually egg freezing is more long-term solution. And so our patients who have done egg freezing and embryo freezing with us, those eggs and embryos are still safely secure in our facilities. But our IVF patients and our IUI patients, we have so many same-sex couples who have had children with us. We call them our kind babies, and we love getting their pictures. Our IVF success rates for 2020 were over 65%, and just to give you an idea, the national average hovers between 50 and 55%. So we're exceeding that national average by at least 10% at 65%. And 65%, you're like, wait a minute, that's like a D student. But if you think back and realize that the success for a very fertile couple to conceive per month is only 25%. So we only have a 25% chance of getting pregnant each month in the most fertile couple. So a 65% success in an IVF patient is huge. And we're happy to share those stories with you guys when you come in. And in closing marks, just to be respectful of everyone's time, it's a new year. Hopefully a lot of new beginnings for us, for our country, for this pandemic. And I really do encourage all of you to take care of yourselves. If you haven't gone to the doctor just for your regular wellness, please come and see us. It's just like it goes processed through your insurance, just like any other doctor's office. If you've been curious about learning about your fertility, but you were nervous to come, maybe scared to hear, where you're at, please don't be. Realize that this information is truly meant to be empowering. And whether your fertility is good or bad, you're always going to have some options, and we're going to help you explore those. And we're here for you every step of the way. Our team members are you. We've all gone through miscarriages and frozen our eggs and had kids when we were 39 years old, and everywhere in between. And we just want to embark the information and really help you get your questions answered and to be the best version of yourself that you can be. So thank you for joining us. On behalf of myself and our entire team and our Kindbody family, we wish you a happy new year. Happy 2021, and we look forward to seeing you soon. Again, you can go to kindbody.com. Making an appointment is super simple, and then Jan101 is the code to take advantage of the discounts. Thank you again. Have a good evening or a good afternoon if you're on the West Coast. Take care. Bye-bye.